Welcome to Enrollment Encore. What you need to know before open enrollment in the health law's marketplaces begins again on November 15th. I'm Mary Agnes Carey. Kaiser Health News senior correspondent Julie Rovner now joins me to talk about the health law and Medicare. Julie, what are the key issues for Medicare beneficiaries when it comes to the Affordable Care Act?
Well, there's not really very many issues from the ACA that directly affect people on Medicare. In fact, people on Medicare are not allowed to be in the exchanges. It's just sort of a coincidence that the Medicare open enrollment period is going to coincide at least partly with the ACA open enrollment period. Medicare open enrollment started in the middle of October and it ends December 7th.
And we've heard a lot about changes in payments to these private health insurance plans in Medicare, known as Medicare Advantage. What has been the impact of those changes in the number of plans offered and also for beneficiaries?
That's right. One of the ways that the Affordable Care Act is paid for is by cutting some of the payments to the Medicare Advantage plans because they were being overpaid by about 14%. Now, the last time Congress tried to cut payments to Medicare Advantage plans in the late 1990s, a lot of those plans left the market. A lot of seniors were left without any options. That's not been the case this time. The cuts are being phased in more slowly. There are slightly fewer plans, but not that many fewer, and actually enrollment is way up in Medicare Advantage plans. It's up 41% since the ACA passed in 2010.
There's also some changes in what they call the donut hole, this gap in coverage. That's shrinking, and also some higher income beneficiaries may pay more for their coverage. Can you tell us about that?
That's right. Some of the smaller changes that the ACA made to Medicare, there's new preventive benefits for seniors. As you mentioned, the donut hole, which was a big issue. This is when seniors are still paying for their Medicare Part D coverage, their prescription drug coverage, and not getting any benefit from it. That's no longer the case. That donut hole is slowly being closed. By 2020, it will be basically all the way gone. And of course, for higher income Medicare beneficiaries, those who make more than $85,000 as a single or couples who make more than $170,000, they do pay a couple of additional taxes, really. They are supplemental premiums that they've already been paying for Part B, and now they're going to pay them for Part D for their prescription drug coverage as well.
Thank you, Julie Rovner with Kaiser Health News.
Thank you.